Great pleasure to introduce Sarah, our presenter for today. So Sarah Joy is the social work manager at the Sydney Eye Hospital. She leads a team of 2 experienced senior social workers supporting patients who present with hand and ophthalmology health issues. Her clinical background for the past 15 years has been in mental health, counselling, trauma-informed care, and working with diverse populations to ensure independence and positive and social and emotional well-being. As well as working directly with individuals, Sarah has considerable experience in providing support and education to families and carers. Sarah has personally been in the caregiving role for her grandmother, who has had macular degeneration, and her mother, who has recently been diagnosed with macular degeneration. Over to you, Sarah.
Okay, thank you, Christina. So nice to be on board with all you today. As Christina said, my name's Sarah Joy and I'm the social work manager at Sydney Eye Hospital. I've been on quite the learning curve for the past 12 months, having moved across from working in inpatient mental health for the past 15 years. My social work team assists individuals who access inpatient and outpatient services of Sydney Eye Hospital. What the social work team helps people with might fall under 2 broad categories. Firstly, things like practical support, so it might be referral to community or social supports. It might be things with Centrelink, IPTAS, other practical matters. And also counselling support, where it might have been that social or emotional wellbeing or mental health issues might have been flagged with the social work team. So we pop by and speak with the person or their family to see how we can support them whilst they're accessing our inpatient and outpatient services. I'm really honoured to be here speaking with you today. As Christina mentioned, this is an issue that's very close to my heart, as my grandmother was diagnosed with age-related macular degeneration 15 years ago, and my mother was recently diagnosed with MD in one of her eyes. For my nan, I've been in a caring role with her to help enable her independence over the years. She's been really fortunate to have had the support of the Sydney Eye Hospital, MDFA and Vision Australia, and because of these supports and access to services, at 89 she's still going strong at home. I just thought I'd take a quick minute at the start of the webinar to do a quick overview of where we're headed today together. So the first thing we'll talk about is why we're talking about social and emotional wellbeing, what it is that social and emotional wellbeing is, to consider wellbeing as a continuum, to talk about what are the social and emotional issues that are associated with vision loss, common emotional reactions, what helps to maintain social and emotional wellbeing, and also practical resources. I'll just have a bit of a disclaimer. As Christina mentioned, the information that I'm providing today is general in nature. And if any of the content flags the need for support, by all means, please call MDFA on 1800 111 709 for non-emergency related matters. Or if something gets sort of triggered for you today, then by all means, call the mental health access line, which is 1800 011 511 or 000. So let's get into it. So Sydney Eye is a quaternary referral unit for eye diseases. We see patients from all over New South Wales and occasionally interstate. We provide clinical services regarding the surgical and medical management of vitreoretinal, corneal, glaucoma, oculoplastic, uveitis, ocular oncology conditions. And what this essentially means is that we're a specialist niche hospital and centre of excellence for eye care, but also we provide trauma hand care. We also have a 24-hour emergency department for eyes and for general health, and outpatient departments including eyes, general and hands. I just want to do an acknowledgement to country. I acknowledge the traditional custodians of all the lands throughout Australia, and I pay my respects to elders past, present and future, for they hold the memories, the culture and the dreams of Aboriginal and Torres Strait Islander peoples. I recognise and respect their cultural heritage, beliefs and continual relationship with the land, and I recognise the importance of the young people who are the future leaders. I'm coming to you today from Gadigal land, which is part of Eora Nation. Okay, so why are we talking about social and emotional wellbeing? So the literature that I reviewed in preparation for this webinar, the articles that I reviewed relating to vision or vision impairment, there was often a big focus on surgical, medical, or treatment aspects of care, and not a real lot of discussion regarding social, emotional, and mental health wellbeing in relation to vision impairment or loss. And for someone whose bread and butter is mental health, this came as a really big surprise to me, particularly because the articles that do talk about social and emotional wellbeing put the figures anywhere between 1/3 to 1/2 of people with vision impairment or loss might suffer from depression, anxiety, or another psychological condition. An Australian Psychological Society article that I reviewed indicated that depression rates might be 2.5 times the prevalence rate for people with vision impairment, but the rates for screening and diagnosis are often poor, and up to 80% of people with depression and vision loss might not get support for this. The article that I reviewed also spoke about that only 9% of those people had access support. Importantly, other articles notice that that do talk about mental health impact is that mental health related issues often occur after the diagnosis of a vision impairment. And it's not necessarily something to do with the individual that they were predisposed to, and that can also have very serious health outcomes. So whilst we acknowledge that each individual's journey is unique, the literature clearly points out a correlation between chronic health problems and increased risk for depression, anxiety, and other psychological conditions. We know that chronic conditions, even which is cumulative over time, can be frightening and overwhelming, and can bring a range of emotional reactions, which I'll talk about later in the webinar. There can be concerns about independence in doing tasks of daily living, moving about in the community, whether one will be able to drive and do other tasks such as work and socialise, and do tasks that might enable you to be part of active parts of communities that are important to you. And this can lead individuals to worry about what the future might look like, what planning might need to take place, what other areas of health will be affected, whether things like falls will become more common, and what might need to be done to mitigate risks. Of course, it's not to say that if someone has a vision impairment, they'll necessarily be predisposed to developing a mental health condition, nor is it to discount the age in which the vision condition occurs and a number of other variables. But this is something that we should routinely be thinking about, and when we do so, we'll move away from illness or deficit models of care and move towards more holistic ways of managing vision conditions. So what is social and emotional wellbeing? According to the World Health Organization, social and emotional wellbeing refers to the way that a person thinks and feels about themselves or others. It includes the ability to adapt and cope with daily challenges, so resilience and coping skills, whilst leading a fulfilling life. So at its core, social and emotional wellbeing is about how an individual functions at an individual, family, and community level, and how this can influence or be influenced by environmental or health or social factors. Or put even more simply, social and emotional wellbeing means the ability to realise your abilities, cope with normal stresses of life, work productively, and contribute to and be active in your communities. Mental wellbeing refers to your mental state, how you're feeling and how well you can cope with day-to-day life. And if you experience low mental wellbeing over a long period of time, you might be more likely to develop an ongoing mental health problem. So attending to both mental health and social and emotional wellbeing are a critical part of the management of overall wellbeing. In many ways,
sorry, just to put a little bit of a stop in there, sorry. I think we're having some issues with viewing your slides. Are you able to share your screen?
Yes. Niv, how do I do that? Can you see it now? Hello?
Hold on a second.
Yeah, we can't see it quite yet. I think you might have to try share your screen on the GoToWebinar app. I think you might be able to press show.
Is that better?
Yeah, there we go.
Oh gosh. My apologies, everybody. So you couldn't see my webinar, but you could see me.
We could see you, but not the slides, but we can see it now, so that's the most important thing.
Oh, good. All good. All right. So let's sort of get back on track. In many ways, we need to imagine our mental well-being as being like part of a continuum. Like with mental health wellbeing, we move between periods of illness and wellness, and there might be many issues in the middle that might affect us. We know from collective expertise that receiving a diagnosis of a long-term health issue can be traumatic, that there can be social and emotional wellbeing impact associated with vision loss that can affect and inhibit psychosocial wellbeing. But we also know that there are many factors that can facilitate a return to psychological wellbeing, and it's to this that I now want to turn to. So what are some of the social and emotional wellbeing issues associated with vision loss? As some of you will be familiar, the issues associated with vision loss or impairment can vary according to many factors. And my intention here is not to be prescriptive or to outline the following as though they occur in the same way for every individual. Some may notice some, others may relate to all, and yet others still might not relate to any of these. You might also have other things that you can think about that I've not mentioned, and I really welcome hearing about those. For some people, changes or loss to personal independence due to vision impairment or loss can make it harder to do tasks that people have previously enjoyed, such as cooking, socialising, hobbies, or driving. Maintaining or establishing new social relationships can be harder due to not being able to read social cues, not being able to identify who's speaking and when it might be your turn to talk. And there's so much that we take for granted when communication becomes harder with vision changes, because it can be harder to negotiate these cues. It might lead some people to avoid social situations that are unfamiliar, especially if they have to go alone and not with someone who can help navigate unfamiliar locations or situations, such as having a family member or a friend along. The extent to which social issues can be affecting people can be affected by the age of onset of the vision impairment and the pre-existing social network and community participation prior to the vision condition. Some might find that some relationships change whilst others are strengthened. What we know is that social interactions and relationships are critical to social connectedness. We also know that access to social resources are embedded within social networks, and without this, there can be reduced access to information, support, and this can have an effect on maintaining independence. Others might notice change to occupational or working life. Tasks such as negotiating transport, driving, carrying out work tasks, worries as to whether or not your workplace will be able to make suitable adjustments to accommodate your vision impairment, and learning new ways of doing things can all be sources of stress and anxiety. Additionally, there might be worries if this changes to your good eye, if the vision impairment is present more in one eye than another. There might be increased emotional distress if a task that's been familiar to you over many years suddenly becomes harder to do. And for others, it might have been that they've worked their whole life, either in paid or unpaid roles, and it might have been in their retirement years that they're diagnosed with a vision impairment. This can lead to changes in what you, your partner, or your family might have hoped or dreamed your retirement years might look like. Others might notice financial worries associated with their vision impairment. There might be issues or anxiety to do with procedures, costs, transportation, and appointments, particularly if you're not based in a metropolitan city. Particularly during retirement age, if you do not have family to offset the cost of treatment, or you may not want to be perceived as a burden to your family by asking for financial assistance, this can have flow-on effects to mental health and psychological well-being. Functionally, there might be issues associated with tasks of daily living, seeing the labels on things in the supermarket, not wanting to draw attention to yourself by taking a magnifying glass so you can read the small print, being able to read and sign documents independently, completing housework where central vision might be important, meal preparation, money management, or using the telephone where the buttons might be small, such as on a mobile phone. All these things can be trickier when you have a vision impairment. And naturally, all of these factors can have impact on social and emotional well-being and mental health. Health can be another issue that can be affected by vision impairment, especially if there's multiple health issues co-occurring at the same time. Taking multiple medications, juggling specialist appointments, and being able to read and digest treatment information, especially if it's only given in a visual form, can be trickier, and it might increase your reliance on having to have a support person there to read documents and remember important information, especially as you might be caught up with managing emotional reactions, which is completely understandable. And it's to this emotional impact that I now want to turn our attention to. In preparing for this section, I consulted with my mum and my nan for their experiences and their emotional reactions in being diagnosed and continuing to live with MD. This is not to say that their experiences are representative of all people, but it was what they said to me was very consistent with what I was reading in the literature and with patients that I've worked with over time at Sydney and Sydney Eye Hospital. So what are some of the common emotional reactions associated with vision loss or impairment? Both my mum and my nan reported at the start of their journey feeling worried. For my mum, there was worry prior to her recent diagnosis. The worry of what the wavy lines could mean, and knowing that deep down that she might have MD as her mum had had it. Then once diagnosed, had she got onto it early enough? Worries that even though the clinical staff had reassured her about, she nonetheless expressed worry about. Will I go blind even though the doctor said that I won't? What will I do then? Will I be able to continue to live by myself? Will I still be able to do my hobbies? And for my nan, who worked 6 days a week her whole life and played golf on her off day, this was very important prior to her vision impairment, prior to her retirement. So not being able to sink the ball into the, to sink the final putt into the, when she was on the green was a very big deal for her. Worry about how long she could keep working, even though she might not be able to see well enough to do her job. But thankfully, she'd done her job as a dry cleaning presser for about 40 years, so she was able to work for a good many years after her MD diagnosis. Anger and frustration was something that they both also spoke about. Will other people know or understand about MD? Should I be able to go out in the sun as much? Frustration about the impact on appearance, big hat, sunnies to avoid the glare of the sun. And for my nan, who's a staunchly independent person, frustration with having to ask for help when she might rather be independent, and when people who help are not really that helpful. Like if someone at the bus stop doesn't really want to tell her the bus number, or at the supermarket when she's looking for a product and someone who is helping her gives her something that's close enough but not exactly what she was looking for. And for the cooks in the room, you'd know that short crust is not the same thing as puff pastry. And sometimes it can be the little things that can become the big things. Like if Nan cannot find a recipe she's wanting to cook and it can take her a long time to find it, or having to be careful when making a cuppa or cooking so that she doesn't overpour something and make a mess, which can be harder to clean up when you don't have central vision. And if you have a double whammy of shaky hands and a vision impairment like she does, it can be difficult to measure or pour or carry items from the kitchen to the lounge room without making a mess. Sadness, grief and loss can also be common reactions. Why me? Why now? What will this mean for my future? Sad that it can be hard to read things, to do crossword puzzles, or to have to sit up so close to the TV in order to be able to see it, to not be able to see the faces of loved ones clearly. And it might be important to consider that grief and loss can be multidimensional. It's not just the loss of the actual eyesight, but it can be many other things that come with it, and having to make adjustments that you did not anticipate having to make. Though both my mum and my nan reported that it depends on the day and how much they notice their vision condition affecting them. Embarrassment can be another common emotional reaction to having a vision impairment, whether people will notice the vision impairment, whether she can order something that's hard to eat at a cafe, whether when someone says hello to you on the street and you might not remember their face in order to match it to the voice, especially if it's someone that you've known for many years as a casual acquaintance and you may not want to appear rude by not knowing where you remember them from and not using their name. And it can make it difficult to go to new events, even if they sound interesting, because it can be hard to locate the venue or the correct room, to know who to ask for or how to find your seat, especially if you don't particularly want to sit up the front. And this can lead to avoidance, as it sometimes might feel better to not put yourself in situations that might be embarrassing or frustrating, as not all people might realise the adjustments that need to be made in order to get to different appointments, or to have an appreciation of all that you've had to negotiate in order to be there. And sometimes it can feel frightening or overwhelming, not being able to see what's in front of you, worrying about whether you'll see the cracks in the sidewalk, worrying about whether you'll be able to navigate unfamiliar locations, such as if you wanted to go on holidays by yourself. And it was only after working at the eye hospital and talking with MDFA that Nan and I realised that she was experiencing Charles Bonnet syndrome, which is common for people with vision impairments. Nan and I would talk about how sometimes she would wake up in the night and see someone in her room, and this would frighten her. And she would often have to go to bed with a torch beside her. We would talk about how she didn't want to tell anyone in the family in case they thought that she was mentally unwell, but I knew, having worked in mental health, that she wasn't mentally unwell and that it might just have something to do with her vision loss. MDFA were really wonderful in giving me written information and sending Nan audio information about what Charles Bonnet meant and how we could learn more, both learn more about it. And so Nan now doesn't feel so frightened anymore when it happens to her. Fear and anxiety might also be an important part of the picture. Fear of falls or safety when going out. Some people might fear looking or feeling inferior as a result of having a vision impairment or disability that they didn't anticipate having to have and which you didn't have any experience in having to make adjustments for. And feelings of depression and anxiety can be significant. For a person to be diagnosed with clinical depression, they would have to have 5 or more of the following symptoms, at least one of the first 2 for at least 2 weeks. An unusually sad or irritable mood that does not go away, loss of enjoyment or interest in activities that might have previously been enjoyable, lack of energy or tiredness, feeling worthless or feeling guilty when it's not really you that's at fault, thinking about death a lot or wishing they were dead, difficulty concentrating or making decisions, having sleeping difficulties or sometimes sleeping too much, and maybe noticing changes in appetite, maybe less interest in food or eating too much. And anxiety can present differently, but it also can be frequent and persistent. And it's not always connected to an obvious challenge, but it might nonetheless affect quality of life and day-to-day functioning. Whilst there are different anxiety conditions, they each have their own unique features. And some common symptoms include physical symptoms, so panic attacks, hot and cold flushes, racing heart, tightening of the chest, quick breathing, restlessness, or feeling tense, wound up, and edgy. There might be psychological symptoms, excessive worry, catastrophizing, excessive fear, or obsessional thinking. There might be behavioural symptoms, avoidance of situations that might make you feel anxious, and that can impact on study, work, or social life. And in discussing the symptoms of depression and anxiety, this is not to diagnose you, but to alert you to the fact that having a number of those symptoms over a prolonged period of time in which affect your ability to function might give you pause to discuss with your general practitioner or to discuss how you've been feeling with your health providers. The main focus in raising these issues is to consider the impact that they have on quality of life and social and emotional well-being. We all want people to live the best, most healthy and independent lives that they can. And so what helps to maintain social and emotional well-being when someone's diagnosed with a vision impairment? And it's to this that I now want to turn. As with many conditions, the earlier you receive information and support, the better. We're so fortunate to have access to such high quality information, but we all know that it needs to be delivered in a way that's meaningful and consistent and understandable to you and your family members. If someone gives you information in a way that you don't understand, please get them to explain it in a different way. Don't be afraid to ask questions over and over again if necessary. And I encourage people to access information in different formats if possible. Explore what information is available in printed formats, on websites such as MDFA's, and you can always call up because sometimes it's just nice to talk to a real person every now and then. If it's not available in the format that you want, tell somebody, because this feedback can be very, very useful in knowing what's meaningful and helpful to consumers, as it can then be developed. And this might also help someone who comes along after you looking for exactly the same information. Also, try not to worry about being a bother or a burden to health or other staff. Ask the questions that you need answered. It's better to ask those questions. That's what they're there for. I do encourage patients to write things down. Often in busy clinic environments, it can be easy to forget the questions that have been on your mind for many weeks and to feel that no question is too small or silly. Oftentimes, it's something that another patient has gone through, and this in and of itself can be helpful to know that someone else has been worrying about something that has also been on your mind. Telling your health and other providers how you've been feeling. I know that one of the things that I found most meaningful in my work with clients has been the experience of feeling heard, cared for, and understood. That you might get valuable support so that you don't have to struggle on alone, because isolation can be a very big risk factor for social, emotional, and mental health well-being. It might result in you being able to speak with a support person, a social worker, a counsellor or another professional who can support you, who might flag any risk factors for mental health conditions and just might help keep you emotionally strong and healthy. Educate your family and friends. I don't think I appreciated this at the start of my Nan's macular journey, just how important it was that I understood and made sure that I understood the treatment that she would be receiving. I also didn't appreciate that if I had a direct relative, so a parent or a sibling, that I was at increased risk of 50% of developing it too. Now my mum's been diagnosed with MD in one eye, and I only had my first eye check done last year. So encourage your family and friends to have their eyes checked. Early intervention is the key. Even if it's just simple things like that they're ensuring that they're following a diet that promotes good eye health or taking supplements. Being correctly informed with the most up-to-date information or being abreast of the latest research can be so important in being empowered to know how to handle situations that are happening currently, but also how to prepare for what might lie on the road ahead. It can also be important to plan and think about alternative ways of coping with tasks that you might find hard. In this way, it can be super important to have an overall sense of how you're coping functionally, as this can help identify areas of strengths, but also ensure early identification and problem solving of things that might be challenging. It might be useful to participate in educational support programs such as Vision Australia's Quality of Life programs, their telehealth programs, or their peer support programs. MDFA has their education sessions and peer support, and your own health providers might have their own education sessions also. All of this can be super important in knowing what adjustments are possible and what the latest information and research is. It can also help with developing additional problem-solving skills to overcome any barriers in daily routines and to help overcome any negative thinking patterns that might arise. Further to this, it'll give you an idea of what vision aids are existing, as there are a great many things that can help you keeping you well and safely functioning in the community. And in writing this webinar, I think it needs to be highlighted the importance of saying what it is that you value and discussing this with your support networks, as oftentimes people in our lives can be very well-meaning. And if they're fully sighted, then it might very well be easier for them to do something for us. But this is not the point sometimes. Maintaining your skills and seeking out those things that can be reasonably adjusted can have a big flow-on effect to your social, emotional, and mental health well-being. It might be that acceptance and adjustment can come as the condition stabilizes, but being clear on what it is that you value early on means that your wishes and hopes are more likely to be respected along the way. Maintaining an active life in the community can be extremely important to ensuring positive mental health and ensuring your resilience over time. It might be that hobbies exist in a modified form, for example, blind golf or support to attend a walking group. And peer support can be so meaningful, and many peak vision bodies have them embedded within their organisation now, like MDFA does. But it might also be that next time you visit your clinic, you make contact with someone sitting close to you. And when you do that, I want you to notice for a minute what it feels like to be connected to a group of people that might understand exactly how you're feeling. We'd love to see a scenario next time you visit your health providers that you take a minute to smile, nod, and say hello to the person next to you, because chances are you might be visiting those clinics together in the next coming months and years. We want services that are based on connection and peer support, or just connection if that's all you want. And to connect with services like MDFAs, because then you can access the peer support at a time that's convenient and helpful to you. And finally, don't be afraid to access counselling when you need to. It's extremely common that emotional reactions will vary across time and the phases of your vision condition. If you attend a hospital environment, you can be asked to be linked to the social worker, or you might choose to get a mental health care plan through your GP at a time that's convenient to you, and you might also be able to choose the type of therapist that you want to see. They might be of psychology, social work, or counselling background. And if you're a family member or a carer, you might choose to visit Carers New South Wales or access the National Carers Counselling Program, or to access information via the Carer Gateway. Accessing counselling doesn't have to be a long-term thing, but just a few sessions might help keeping you well and your emotional well-being in tip-top shape. And in closing, I just want to share a few practical resources and supports available to those experiencing social and emotional well-being and vision loss. I'll just note that MDFA will also add some of the following web links into the chat function, so just look out for those. Okay, so in terms of mental health, many of you would be familiar with Lifeline. They have wonderful resources on their websites, fact sheets and little toolkits that can be really, really helpful in just giving you that little bit of extra information. And their number is 131114. For the men who are on the line, Men's Line have wonderful supports available on their website, and their number is 1300 789 978. Now, if suicide or suicidal ideation is something that's been sort of an issue for you, then please, know that that service provides 24/7 phone counselling, 1300 659 467, and their website has wonderful resources. So I encourage people to look at those. And Beyond Blue similarly has excellent information, are very, very well known for their work around depression and anxiety. Their number is 1300 224 636. Mental health first aid, if you can access those courses, they're absolutely brilliant, and having worked in mental health for a long time, I can't recommend them highly enough. They also have wonderful downloads that you can, if you can't do the course, you can also access the information via the website. The Black Dog information has a lot of very, very practical tools and apps, and I encourage you to visit their website or even to give them a ring, 9382 2991. And as I mentioned at the start of the webinar, if anything's been triggering for you or has come up for you and you feel like you need to speak to someone in a more urgent fashion, then the mental health line will put you through to the mental health service in your local area. And that's 1800 011 511, or of course there's the emergency line 000. In terms of counselling options, I mentioned in my talk that there's the mental health care plans, and that enables people to access up to 10 sessions a year and receive a Medicare rebate back. So I've just included the web link that you can access a bit of information about that, but also if you speak to your GP about it, they'll be happily able to provide you a mental health care plan. In terms of if you want to identify the therapist that you would like to see, a number of peak counselling bodies have find a therapist function. So the ASW, they also have mental health accredited social workers. The Australian Psychological Society have their find a psychologist function. And PACFA, who's the peak counselling body for counselling therapists, they also have a find a therapist function. In terms of for the families and carers online, carer counselling is available through the Carer Gateway, so you can access that through the website listed there. And in terms of vision-related supports, it's really worthwhile getting to know what they offer. Vision Australia, 1300 847 466. In terms of the vision aids that can enable independence and quality of life, they have their quality of life support groups, the Telelink and peer support groups. MDFA have a wonderful website and fantastic resources that I use all the time. 1800 111 709. Guide dogs, 9412 9300. And by all means access that website. And NDIS is something that people may not have considered. So I've just included the web link that will direct you to the part that might help you determine if you're eligible or not for NDIS support. And in closing, my name's Sarah Joy, Social Work Manager at Sydney Eye. You're welcome to call me via the switch, or my email's listed there. And I'm going to hand over to Christina now to do a little bit of extra talking before we head into the Q&A. Thank you so much for listening.
Hi, Christina. Appears that you're muted.
I couldn't hear you either.
Hello, sorry.
Technical issues, everyone. Sorry about that, but we're back on track again.
All right, so starting from the start, so thank you to Sarah for such an informative presentation on a very important area. So I wanted to remind people that you can ask questions by clicking on this icon here on the right-hand side. And hold on a second. And typing your questions in the box. It's been unmuted. and clicking send. Alternatively, you can call us on 1-800-111-709 and one of our staff will forward on the questions to us. So to give Sarah a little bit of a break and to also talk about the foundation a little bit, so the Macular Disease Foundation, it aims to reduce the incidence and the impact of macular disease in Australia. So we have a few different areas of work, the first being in prevention and early detection. We aim to raise awareness of macular disease in the community so that people take early action and get their eyes tested sooner. So our awareness campaigns include our annual Macular Month media campaign, as well as education sessions where we deliver education to community groups and the general public across Australia. We also provide supports and services. So we support people living with macular disease to ensure they continue to live well. We have free information resources on our website and available to order at no cost. And we also have a national toll-free helpline where we are able to provide tailored information and advice on areas including diet and lifestyle changes, Medicare information, accessing NDIS My Aged Care, just to name a few. We are also able to refer on to other support services if required. Sarah mentioned our peer support program earlier. So we do have two different peer support programs. Our first is our peer-to-peer telephone call service, which involves our wonderful team of volunteers, many of whom have macular disease themselves. So they make scheduled phone calls to our community to check in and provide an opportunity to share stories and experiences. We also have a peer support group in Victoria. We are also the voice of the macular disease community. We advocate to government and other stakeholders to ensure that people living with macular disease are able to access support and services to continue to live well. And last but certainly not least is research and data. So we conduct regular surveys to investigate the impact of macular disease on the community. This provides information for us to better inform the work that we do so we can continuously improve, and also serves as an evidence base for health policy. Our research grants program to date has provided over $4 million worth of funding to researchers across Australia. Now, I mentioned the toll-free helpline earlier. So the number is 1-800-111-709. This phone number is available from 9 till 5, Monday through Friday, Sydney time. If you have any questions about macular disease, feel free to give us a call. Of course, you can also email us at education@mdfoundation.com.au. We also have a website where you are able to view, download, and order free resources to be delivered to you.